Hello everyone. Today we will discuss an article from the Hindu newspaper titled Wrong Priorities. This is the first editorial in today's newspaper and critically analyzes the opening up of places of worship at a time when infections are still rising. Wrong priorities. By opening up religious places for worship now, India risks high community transmission. Community transmission is when there is no clear source of origin of infections in a new community, when you can no longer identify who became infected after being exposed to someone who interacted with people from the originally infected communities. Some things are better kept for later during a pandemic, and public worship is certainly one of them. When epidemiologists were recently polled in the US on when they would think of attending religious service, 43% of about 200 respondents said they would consider that in 3 months to a year, and an equal number said that not for 1 year, means after 1 year, not before that. Their caution on mass religious gatherings which do not lend themselves to physical distancing and have a history of amplifying the COVID-19 pandemic in more than one country should sober down governments that are keen to open religious places early in the unlock phase. To lend oneself means to change, to adapt. To amplify is to increase the intensity of something, and to sober down means to get serious about something. So, religious gatherings usually do not change enough or adapt enough to physical distancing, and they usually have a history of increasing the spread of any infection, in this case COVID-19, and it is because of this that the government should get serious about certain things when they are trying to unlock the country. Even with online registration, e-passes, distance marking and use of personal protective equipment by staff, gathering in confined spaces go against the grain of infection prevention principles. So in any religious place of worship, people gather and it is usually a confined space. So there is not much room for taking care of physical distancing, etc. And these go against the grain of infection prevention principle. To go against the grain means to be contrary to the natural inclination of feelings, means basically contrary to something. So the basic principles of infection prevention do not stand in places such as these, where people gather, and even after such facilities have been made, like online registration, e-passes and others that have been mentioned here. It is heartening that some temple boards, churches and Islamic religious bodies have wisely decided to remain closed. As among the top 5 virus affected nations, India cannot afford to create conditions that lead to mass transmission. The priority today is to refloat a crippled economy safely while postponing all optional activities to a time when there is better disease control and prevention and treatment courses are available. So the priority right now is to refloat a crippled economy, to enable the economy to run in the same pace as it was running earlier, and any other activity that is not necessary, that is optional, should be deferred till a time when you are better equipped or better prepared to handle it. The compulsion to unlock when infections have not peaked has already placed the onus of remaining safe on people, a significant section of whom have health vulnerabilities such as diabetes. Now, after the opening up of such places, the responsibility, the onus of remaining safe is now on the people. It is people now who will be responsible for themselves, to take care of themselves and to keep themselves safe from the infection. And a significant section, a large section of these people are already vulnerable to certain health conditions such as diabetes. Going by ICAMR linked studies, the disease burden for diabetes alone has grown 80% since 1990, highlighting the enormous risk of virus exposure. Millions of such citizens now face aggravated community transmission. Imagine of such people, a large number of such people when aggregate at such places where the chances of getting infected are more, and their immune systems are already down because of these vulnerabilities such as diabetes. So the citizens now, that is why it has been written that millions of such citizens now face aggravated community transmission. After pursuing a lockdown strategy that had low impact on the infection curve but many negative outcomes, India needs to draw up its unlock priorities carefully. It must show the political will to enforce norms on public behavior such as mask wearing and physical distancing. Yet, the scenes from many cities coming out of lockdown, including hard-hit ones such as Mumbai, show anxious crowding in many situations, including on public transport. Night curfews are weakly enforced. This is worrying considering the limited medical capacity that exists to care for a large number who might suffer the worst effects of COVID-19. So we all know the capacity of the healthcare system in India is not much, and in that scenario, it is only by enforcing restrictions that one can manage this pandemic. If you don't let the disease to spread, then your healthcare system will be, or our healthcare system will be equipped enough or have the capacity basically to treat whoever gets infected. But if large numbers get infected, even the healthcare system will get overwhelmed, and we can say that will be a crash of the entire system. Getting unlocking wrong could mean an explosion of cases, which WHO has warned, World Health Organization has warned, remains a possibility in India, Pakistan and Bangladesh. National policy should not put the cart before the horse by prioritizing activities such as worship at public places. To put the cart before the horse means to reverse the proper order or procedure of something. So when the priority is something else, and at such a time when the government is putting some other things before those priorities, it is basically reversing the entire procedure of how the country needs to be unlocked. All available resources must be devoted towards productive and essential work, and not towards managing places of worship which you have opened for people to aggregate, and chances of getting the virus spread even more. Center has to also explain what it is doing to assess the prevalence of infection at the community level at a suitable scale, which is crucial to identify focus areas and decide the course of further unlock phases. So more work should be done towards identifying community level measures that are being taken, and to identify focus areas based upon that, and to decide what course of action needs to be taken. So this is what the priority should be, and not towards opening up places of worship that may or will increase the spread of this virus. So this was today's editorial. It critically analyzed the government's move of opening religious places and cautioned against intensifying spread of this disease. I hope you understood this article well. Feel free to come up with your interpretations of this article and doubts and questions if you have any. I am available via any means of contact mentioned in the description of this video, and am all ears. Signing off for today. You take care of yourself, stay in and stay safe.